The reason that this is important is because communities like Dhek Bhal and the South Asian community are marginalised. They're often left out of healthcare research. It's fair to ask people their opinions on services like NHS treatments that will affect them. So if they want to have a say, then they ought to be able to have a say.
So it's my first time I've been part of a research team in this department, musculoskeletal issues. It's nice to be frontal with and have these face-to-face meetings with people we don't generally meet, and I think this research gets to the heart of things, you know, gets right down to the core of things, you know, where you may assume that it's not possible for me to get my voice across, or something I'd like to know more about, or something I'd like to add, which may be a change for upcoming future patients, and to be able to do that and voice yourself. I think it's been a really nice experience. It's been a good journey so far, and knowing you'll be able to make a change at the end of it, it's a great feeling.
Like if somebody said to me, would you like to do it? I would love to do it, because it helps other people after us, like for our generation and the next generation.
Really, it's been an amazing experience for researchers to come into communities like ourselves, diverse communities, ethnic communities to be specific as well, who don't get that chance. It's given us a feeling of involvement and gaining great knowledge of the fact, and knowing there's a team out there that can absolutely tailor a research program to your needs. So there's no stone unturned, really.
Yeah, I was very glad to know that the research team came up here. We got a chance to say what we want to say, and somebody care about it, and it will improve what the community needed.
I think it's about remembering that beyond research, this is about people, and it's about building relationships with those people. And part of that is making sure you have time to sit and listen. The power of having a cup of tea and a chat and giving that space and time to someone is so worthwhile. So we created that illustration
Yes.
to give back to you
Yes.
and to other members of the community, so that you can use that
Yes.
for researchers going
Yes.
forward.
Yes, yes. It's an asset, you know, yeah, because it's a tool that we are using now. So when anybody come to me, I say, this is the tool that you have to follow.
Bring these research teams to the centre here, and to talk to people, which help then the researchers get there, like you said, whether it be over a cup of coffee or something. It was really getting down to what they wanted, and to ask them how they would like this research panned out, how it would benefit them.
The researchers provided us with the brainstorming opportunities in creating this poster based on various questions and issues. So this was really good exercise for everyone to take part in, and everyone felt that they have been given an opportunity to be included and given the opportunity to ask the question or raise a concern.
I'm sure there are so many organizations that do more research around so many things, but they need to come out to groups like us and all the other groups as well, and they get feedback from the people, and then they can add those information in their research. Because this, most of the time information is like in English, or nowadays it's all like online. And us a lot, like we don't go on so much, we don't feel comfortable using computer so much like our generation. So it gets very difficult for us to get those informations. So that's why there is like a barrier, there's a language barrier, we don't take part in it. And then researchers, maybe they think, oh, these Asians, minority, ethnic minority, they don't want to get involved, they don't want to take a part in it, so they ignore us. So that's how I feel. and they need to come out and consult us like a group, as a Dhek Bhal group and all the other groups as well. They need to come out and involve us in their research as well.
We should always encourage other people so they can take the advantage as well.
I think it's very good for my mum to share her experiences. She lives a lonely life. She's happy to share about her health conditions.
How are you feeling today?
Very happy to see people.
No, she's had a very busy life. She's been a carer. She was a carer for my dad for 18 months when she's ill herself. She's been disabled for a long, long time. Her lift, her bathroom was done 25 years ago. I think for her, health research is much more complex because you don't see the benefits of it straight away. And how do you relate to telling someone about your conditions or how you feel with what's going to be the result of that, as in what is research?
So, are you happy to share your stories of your pain and your health problems if it will help other people like you who might have joint problems or health problems?
I also this time pain and thing. I also people, lots of people I always help. Anybody ill, anybody something, I go and help.
So it's very important this kind of research, because we are hoping people will benefit in future, although we might not be able to, but other next generation will be able to benefit from this research. And that's what we're hoping. That's why we thought it's very important to take a part in this research.
And that is about very simple. It's a simple journey, you know. It's not a like I say, it's not rocket science. Very simple journey, but it's about respecting and, you know, taking the people with you, and not talking down to them, you know, speaking with them with respect, and always consider them as the expertise. Because I always tell my community, I say, you are the experts. We must value people's contribution, you know. We mustn't exploit them or take advantage of them. We must make sure that we value them, we respect whatever they are saying.
We were in a hostel that was like in, right, no, the hostel was lovely. And it was especially nice because no one went outside.